Today we're talking about HHT, which is hereditary hemorrhagic telangiectasia, right there. This is a condition, it's a genetic condition that causes veins and arteries to become enlarged and get tangled up like spaghetti noodles, like this. While it is a rare condition, it only affects about 1 in 10,000 people worldwide, which is probably grossly underreported, but that's okay. It can be deadly. If you get a blood clot up into the brain or into another vital organ, it can cause shutdown, which is deadly. Causes of HHT stem from genetic mutations, 3 of them that we know of. So either the ENG, the endoglin gene, or the ALK1 or ACVRL1, or the SMAD4. I don't have a chart to look at, so you just have to trust me on that. Patients with HHT2 are more commonly experience liver AVMs. Autosomal dominant genetic disorders mean that a person with a mutated gene will pass along the gene to one of their children, and regardless of gender, each of that person's children will have a 50% chance of also having or inheriting the mutated gene. In some very rare cases, a mutation will occur in the HHT gene in the egg or sperm, and the child will have HHT while neither of the parents have the mutation. So abnormally formed blood vessels. Symptoms of this disorder include frequent and long-lasting nosebleeds. We're talking 45 minutes plus, just gushing, cannot be stopped. These patients typically have to go to the emergency room to get help. They don't typically cauterize at the emergency room. They will refer them to an ENT after the fact, but they go to the emergency room to get packing placed or a clip put on, or give them medication to help their blood clot so that the bleeding will stop. And this is some of the things that it could look like. So this is a telangiectasia on the skin. It kind of looks like a rash, but it's not raised or itchy, so that's nice. They can show up in your mucosal membranes, so tongue, inside of the lips, and the gums, and then they can be on the surface of the skin as well. It's typically diagnosed at around the age of 10. If a blood clot doesn't break down due to abnormal blood vessel formation and the clot gets into the brain, it can have fatal results. That's ischemic stroke. The likelihood that it would affect a newborn is minimal, but it does happen. The life expectancy for a person with HHT is hardly different from a person without it, as long as we catch the bleeding and the symptoms and all those things and get those treated early on, and they're relatively healthy otherwise. They should have a pretty normal life expectancy. Okay, HHT in the brain, or that AVM, can have devastating neurologic symptoms. These are devastating. If you have ever experienced any of these are devastating. They're not deadly per se, but they can be dizziness. Like if you cannot get upright without feeling like you've had an entire liter of some alcohol, it's bad. So dizziness, headache, vision changes, seizures, and ultimately can make the patient have a stroke. Lung AVMs cause more chronic fatigue, and symptoms or risks do increase with pregnancy because you have less lung volume and those lungs are working a little bit harder to get oxygen to you and the baby. Liver AVM is the least risky, certainly the least symptomatic, as they rarely bleed or cause any issues. Very rarely they can cause liver or heart failure, can occur later in life, but I'm wondering if that's related to some other underlying issue. Spinal, GI, and nasal telangiectasias also occur. These are the ones that cause the nosebleeds. So really, treatment for this disorder is just treatment of the symptoms. Since it is a genetic disorder, we can't fix broken genes. So that's HHT in a nutshell.